অধিক ক্লিংকার স্বল্প সময়ে নিশ্চিত করে অধিক শক্তি ও স্থায়িত্ব। ইস্টার্ন সিমেন্ট, মজবুত ভিত্তি, মজবুত জাতি।
মজবুত ও দীর্ঘস্থায়ী দেশ গড়ার প্রত্যয়। 7 হর্স সিমেন্ট, নির্মাণে শক্তি।
অধিক ক্লিংকার স্বল্প সময়ে নিশ্চিত করে অধিক শক্তি ও স্থায়িত্ব। ইস্টার্ন সিমেন্ট, মজবুত ভিত্তি, মজবুত জাতি।
মজবুত ও দীর্ঘস্থায়ী দেশ গড়ার প্রত্যয়। 7 হর্স সিমেন্ট, নির্মাণে শক্তি।
প্রিয় দর্শক, সবাইকে আমন্ত্রণ জানাচ্ছি 7 হর্স সিমেন্ট স্বাস্থ্য কথা অনুষ্ঠান দেখবার জন্য। আজকে একটু ব্যতিক্রম ধর্মী অনুষ্ঠান। ব্যাংকক হসপিটাল থেকে বিশিষ্ট স্পেশালিস্টরা আমাদের দেশে এসেছে। আমাদের দেশের বিভিন্ন চিকিৎসা পদ্ধতি নিয়ে তারা দেখেছেন। তাদের সাথেই আজকে আমরা আলোচনা করব আমাদের স্বাস্থ্য বিভিন্ন সমস্যা এবং তার সমাধান নিয়ে। চলুন প্রথমে পরিচিত হয়ে নিই আমাদের অতিথিদের সাথে। আমার ডানে আছেন ডাক্তার ধুন দামরং সাক, তিনি অ্যাসিস্ট্যান্ট সিইও ব্যাংকক হসপিটাল। তার পাশে আছেন মিস জিয়ারানাই বুনপ্রসাদ সুক, তিনি মার্কেটিং ডিরেক্টর ব্যাংকক হসপিটাল। আমার বাম পাশে আছেন ব্যাংকক হসপিটালের অর্থোপেডিক সার্জন ডাক্তার পন্থাকন পানিচিকল। তার পাশে আছেন কার্ডিয়াক অ্যারেথমিয়া কার্ডিওলজিস্ট ব্যাংকক হসপিটাল ডক্টর ইয়াসভি উকায়গন। সবশেষে ডাক্তার সতীত শ্রীমন্তায়ামাস, তিনি অনকোলজিস্ট ব্রেস্ট ক্যান্সার স্পেশালিস্ট। উই ওয়েলকাম ইউ অল টু আওয়ার চ্যানেল আই। দর্শক, যেহেতু তারা আমাদের বাংলা ভাষা বুঝে না, আমরা আমাদের অনুষ্ঠানটি ইংরেজিতেই করব। কোথাও প্রয়োজন হলে আমি আপনাদের বাংলায় সহযোগিতা করব। ফার্স্ট অফ অল আই ওয়ান্ট টু নো মিস জিয়ারানাই বুনপ্রসাদ সুক, this is your first time visit in Bangladesh?
First of all, I need to say hello again and asawadi as a Thai languages. Actually, this is my third time to come to Dhaka, Bangladesh. Eventually, it's the first time after 2 years pandemics, and I can see the differences of the development of the countries, and it's lovely to come back here again.
Do you know, last year we celebrate the 50 years celebration, Bangladesh and Thailand relationship.
Yeah, last year is the 50th anniversary of our diplomat relations, and I felt really grateful because I worked a lot between two countries, Bangladesh and Thailand. Bangladesh are our key country destination that we need to take care. And most of the patients that come to our hospital in the area of cancer, cardio, and also bone and brain hospital. And next year, eventually this year, is our 50-year anniversary in our hospitals as well. So we are expanding, reconstructing many services in the hospital, and we expect that we can provide healthcare services in international level to Bangladesh patients. Again.
Okay, thank you. I want to know, Dr. Dhun, this is your first time visiting Bangladesh?
Thank you very much for having us today. My first time, surprisingly, it was 20 years ago. As a doctor, I came here to do one medevac, to move one patient who is a foreigner, get sick in Dhaka. And then at that time, I was a physician to bring the patient back from Dhaka to Bangkok. That is my first time. And then after that 20 years, I have the chance to come back again.
That was the air ambulance or like this?
The air ambulance, yes, air ambulance, which is come from Bangkok to Dhaka, and then bring the foreigner patient who work here back to Bangkok. But having a chance to come back this time, I would say that it's totally changed.
20 years difference, the total change.
Yes.
What is the change you see in our country after 20 years you come to Bangladesh?
I see all the modern thing is happen now. You have more building, the traffic, and you have the airport also expand. I see a new airport which is nearly finished as well. So I believe that it's a change, and it's change for better and change for good. Yes.
Yes, our health structure is nice and working is nice. Do you appreciate the health structure or health facilities in Bangladesh?
Yes, I also have a chance to visit one of the facilities today before come to the TV. I would say I'm surprised as well. 20 years ago, when I first come here, you have only one or two cath lab for cardiology intervention. But today, when I spoke to one of the cardiology, you have 90 cath lab in Dhaka, which is is changing a lot.
Yes, in the cardiac sector, we develop more and more, and
That's
many
correct.
patients
That's
here,
correct.
and sometimes foreign patient come to Bangladesh for treatment in the cardiology.
That's right. That's right. So again, it's much improved in terms of the healthcare. For us, I think as a healthcare sector in Thailand, and I think everyone know quite well that we have a lot of the medical tourism who come to Thailand for treatment. I think look into at the moment, because you are already advanced, but in some area that we still can help, or maybe we can collaborate with some of the hospital here, in which that we can work together. Currently, we focus on something that we call Center of Excellence. We focus on cardiology, or heart, and brain, bone, and also the trauma.
You actually see assistant CEO in the Bangkok hospital. Do you have any newer treatment, molecular level, or more treatment in Bangkok hospital? Newer treatment in Bangkok hospital?
Yes, every year we have new technologies come in. In overall, we are now more focused on the prevention.
Yes.
So you will see that there are some of the genetic or some we call precision medicine that's starting to be introduced into the market in the area of the how to make you live longer, right? And how you make a healthy living, like anti-aging things, right? That area also become more and more introduced into the hospital now.
I want to ask Dr. Sapit.
Yes.
Since you work as a medical director of breast cancer department in Bangkok hospital, do you share with the symptoms of breast cancer?
Breast cancer patient can present with various symptoms. Breast mass is the most common symptom of the breast cancer, but there are many symptoms such as the mass at the armpit, ulceration of the breast deformity, breast pain, or nipple discharge. But the patient who have those problems may not be early breast cancer. So the patient with early breast cancer are usually asymptomatic or no any symptom. She come to the hospital for the general checkup, to do mammogram and ultrasound, and found some abnormal mass and abnormal calcification, or only small palpable mass. So if the doctor found there is something wrong in her breast, the doctor will advise her to have the needle biopsy to make a diagnosis, and the treatment is based on the biopsy result.
First of all, the self-assessment. If any lump in the breast at the time, you should go to a doctor, specialist doctor.
Yes.
How we prevent the breast cancer? Is there any prevention?
We don't know what is the cause of the breast cancer, so the prevention is very difficult. But we know what is the risk factor. Some risk factor can be changed or can be modified, but some risk factor cannot be changed, such as age at the first period, age at the menopause, no child, familial history of the breast cancer, we cannot change or we cannot adapt. But in some risk factors such as the obesity, alcohol drinking, hormonal use, hormonal medicine, or hormonal pill use, exercise, no exercise, stress, we can adapt or we can change lifestyle. So for the familial history of the breast cancer, if the woman have the strong family of the breast cancer, she should consult the genetic doctor, because the genetic doctor will consider she should check the genetic testing or not, because if the genetic testing show positive or show some abnormality, the doctor will advise her to have the operation or to take the medicine to reduce the risk factor. And the most important, I think, the self breast examination or examine the breast by herself. She should do every month. If she found something wrong, she found the mass or any change, she should see the doctor. And the woman after age of 40s, she should see the doctor to do the clinical breast examination every year and to do mammogram and ultrasound. Because if we found the early stage of the early stage breast cancer is really good, it's excellent. Treatment is easier and the quality of life is much better.
Two things very emphasis we should give emphasis to the one is early diagnosis. Early diagnosis is
Yes.
very important. Early
Yes,
diagnosis.
yes.
And prompt treatment.
Yeah.
As well as possible treatment.
Yeah, because that I told you, the prevention is very difficult. So early detection is
Yes.
very, very important.
Yes, and already you mentioned the examination of the breast.
Yes.
Self-examination of the breast is
Yes.
important. Self-examination of breast.
Yes.
Okay, thank you. Now I go to Pontakaran. Our Bangladeshi people are very fond of sports. You have noticed from Bangladesh in the Bangkok?
Oh, we have a lot of patients from Bangladesh. The first one is the sport injury, direct sport injury. They can come with the tear of the tendon in the knee and the shoulder, and we have the team to take care of them. And another one is fracture. Some patient we have to transfer the patient from Bangladesh to our country to do like some complicated fracture. This is the first group, the patient that have a direct sport injury. The second one is very, very common as well because maybe the patient have a sport injury before, and after that they getting older and older, and they create the arthritis of the knee or the hip because of the sport injury. And this type of the patient, there's a lot of morbidity. They cannot walk well. They feel very pain at the knee, and quality of life is very bad. So they have to come to Thailand to do the treatment to correct the arthritis that come from the sport injury.
There is a ligament injury,
Yeah.
a sports ligament injury.
Yep.
There is a partial tear, a complete tear.
Yeah.
Is there any regenerative treatment in your Bangkok hospital?
Yes, so we have the new technique or the new technology that we can use for this group of the patient. We call the PRP, injection.
yes.
So some literature.
Stem cell, sometimes stem cell therapy.
Yeah, it can help. So some
Okay.
literature show that with the PRP injection, it can help to regenerate the ligament, and also like a meniscus tear, it can regenerate and it correct everything back to normal. And we have this treatment as well. It's very, very new in our country and in our region. So we are one of the first hospital that provide the PRP injection to.
Success rate in the PRP?
That's a very good one.
Very good.
It depends on the degree of the tear as well. If you have a big tear, for sure, we need to do the surgery or something to correct the tear. But if there's small tear or moderate tear, the PRP can help as well.
Okay.
Yeah.
To prevent arthritis,
Yep.
This traumatic arthritis,
Yeah.
what is the method we should take? The preventive measure?
Yeah, the arthritis, the prevention is quite difficult because of the aging, right? Everybody getting older and older. The key is when you reach the age that you have the chance of the arthritis, let's say like more than 50 years old, you can take the supplement which can help. Also, like let's say the glucosamine, it can help for the knee arthritis and the hip arthritis. You can take that, or the exercise to prevent the further damage. Let's say that if you have a good quadricep exercise, quadricep muscle is prevent the arthritis. And also, like Dr. Sathit mentioned, is body weight. Also, the
obesity is the
obesity, right? So
to reduce obese.
Yeah, to reduce
lifestyle modification is very important.
Yeah, very important. This is the thing that we
Dietary
can
habit.
Yeah, can reduce the rate of the arthritis.
Okay,
Yeah.
thank you.
Welcome.
Finally, I would like to ask Dr. Yasabi, since you are a specialist in cardiac arrhythmia,
Yes, yes.
could you please tell us about the symptoms of cardiac arrhythmia?
Okay. The symptoms of the cardiac arrhythmia is vary from the non-symptom and to the symptoms. Usually we will find the people who have the arrhythmia by chance when they go to do the cardiac checkup or the annual medical checkup, and we can see in the ECG that they have the arrhythmia. And they may have the symptoms such as the palpitations, lightheadedness, dizziness, shortness of breath, chest pain, fainting until sudden cardiac death. is the severe symptoms.
Which age is more affected for cardiac arrhythmia?
Okay. The cardiac arrhythmia can happen in all age group. It varies. It depends on the cause of the abnormal electrical abnormalities. We can divide it into 4 groups, 4 major causes of the cardiac arrhythmia. The first of all is a cardiovascular disease, such as the coronary artery disease that can happen in the people around the world. Now, most people can have the coronary artery disease, and hypertension, valvular heart disease, congenital heart disease, or maybe the hypertrophic cardiomyopathy. The second is the medical problem, that may bring them to the cardiac arrhythmia finally, such as the diabetes, chronic kidney disease, obesity, and obstructive sleep apnea. That can be found more and more in the present day. And the third thing is the third one is the aging or elderly that can happen in all disease such as the breast cancer or the orthopedic disease. The heart is also.
What is the suggestion to reduce obesity?
Okay, the aging is more than 65 years old may take a risk for the cardiac arrhythmia as well. And the fourth one, abnormal electrical abnormalities, such as people may be born from the abnormal electrical circuit or the abnormal electrical pathway inside the heart, such as the Wolff-Parkinson-White syndrome, Brugada syndrome, or long QT syndrome, is something like that.
So, do you have any suggestion to early prevention of the cardiac arrhythmia?
Okay, the early prevention for cardiac arrhythmia is like the other cardiovascular disease. Okay, the first of all, I recommend the people should exercise regularly, maybe 30 to 45 minutes per day, 3 to 5 times per week. The second is take the healthy food, vegetable.
Which time you prefer for exercise? Cardiac patient, morning time, no, at the evening time. Is there any suggestion?
Okay, you can walk. If you don't have the time, okay, you can walk in the working site.
Okay.
Or work during go home.
Okay.
Or work or walk on the stairs during the workplace. Okay, I think it's okay, nah.
Okay. And any dietary habit should change.
Okay, change. Take a healthy food such as the vegetable, fruit, and avoid the beverage or the food that contain the caffeine component or the alcohol that can stimulate the heart easily. And the third one is take more sleep, more sleep adequately, such as the 7 to 8 hours per day.
At least.
And avoid to be stressful. And the fourth one is annual medical checkup.
Annual medical checkup.
I think it's essential for the people to prevent any kind of disease. Besides the heart disease, okay, you can prevent other diseases such as well.
As well as stress.
Stressful.
Stress-free life is very important for the protection of the cardiac side.
Yeah. Stressful. Okay. I will recommend to do the meditation.
Yes.
Okay. Because I am the one who do the meditation regularly as well.
Very good exercise.
And the last one that I would like to recommend is if the people in Dhaka have the symptoms such as the palpitations, chest pain, or shortness of breath, or something like that I told before, okay, they can. I will welcome to take care of Dhaka people in Bangkok Heart Hospital.
Okay. Thank you very much.
You're welcome.
Dr. Dhun, you act as the CEO in Bangkok Hospital. Do you have any plan to establish any infrastructure like in the health management sector in our country?
I told you that it's my second time here. The most important is information. And today I think it's a good start that we start to see which area that we still can add to the healthcare sector.
Yeah.
So again, probably too early to tell you that, oh, we have this plan and this plan, because we're just moving back again.
Yeah.
But for sure, I think with the opportunities that we see this time, we probably will look into the area of that you mentioned, whether to find a partner or whether to doing something on the ground.
There is another chapter, is a collaboration, like our manpower go to Bangkok hospital, they train there and come back to our Bangladesh to share your experience in Bangladesh. Is there any opportunity there?
There will be an opportunity there, and that is one thing that I can find that we can make it very easy and I believe that it will be the first start as well. The people know each other. There is a knowledge sharing between the two countries, and something may be right in Thailand, but may not like a culture here to accept it. So we have to learn something. In the same time, we also can transfer some of the medical knowledge in which that we are practice in Thailand and sharing with your practice here to find the matching between that. Again, I look in very positive in terms of collaboration in this area.
So it's a very appreciable to trained person from Bangladesh go to Thailand or Thailand to Bangladesh as a trained and dissemination the technology. Okay. This I think for our country health management is very good.
Yeah, I believe that from my visiting this time, I can feel the culture of Bangladesh people and Thai people quite similar. You have like seniority, you have a good family, quite the same. And I believe that in terms of the medical knowledge and sharing some of the thing together, it can be improving the two sides.
Yeah. Okay, thank you very much to coming here and join in Channel I Talk Show. Thank you very much.
Thank you.
And also thank you very much for nice talking. Thank you. প্রিয় দর্শক, 7 হর্স সিমেন্ট স্বাস্থ্য কথা থেকে আজকে এখানেই বিদায় নিচ্ছি। আপনারা ভালো থাকবেন, সুস্থ থাকবেন, নিরাপদেই থাকবেন। শুভকামনা সকলের জন্য।
অধিক ক্লিংকার স্বল্প সময়ে নিশ্চিত করে অধিক শক্তি ও স্থায়িত্ব। ইস্টার্ন সিমেন্ট, মজবুত ভিত্তি, মজবুত জাতি।
মজবুত ও দীর্ঘস্থায়ী দেশ গড়ার প্রত্যয়। 7 হর্স সিমেন্ট, নির্মাণে শক্তি।
অধিক ক্লিংকার স্বল্প সময়ে নিশ্চিত করে অধিক শক্তি ও স্থায়িত্ব। ইস্টার্ন সিমেন্ট, মজবুত ভিত্তি, মজবুত জাতি।
মজবুত ও দীর্ঘস্থায়ী দেশ গড়ার প্রত্যয়। 7 হর্স সিমেন্ট, নির্মাণে শক্তি।